Hi, good morning. You all have such inspiring stories. And so I'm here, well, partly as a caregiver to my mom who was suffering from diabetes, depression, heart disease. And of course, because I'm their daughter, they do not share their finances. My dad just said, because he's a tax guy, retired from the IRS. He said that when they changed the tax code, that he was concerned about being able to deduct the medical expenses. So I've seen that side of it as a caregiver. However, I wanted to discuss the costs involved from another story witnessing unfolding. A good friend of mine has post-polio syndrome. He is, it is degenerative. He said he had gotten it from from a bad vaccine back in the 60s. He is 65 years old and works, I told him he amazes me. He lives alone, he works full-time, works for the government, works for DoD. He has Medicare and Blue Cross. He said he is still barely making ends meet because of his healthcare costs. And he was sharing with me in particular that he needed a new wheelchair, because one day when I saw him and I said, "You are falling out of that wheelchair." He said he needs a new one. He's being fitted for a new one. Insurance companies are paying for part of the chair. But so I said, "What are you going to do with part of a chair?" So he said, well, the insurance company approved for a manual scooter. I said, that would be of no help. He has no muscle mass. He said he needs the lift. He needs the electronic, the motorized lift on it. And so he has to pay for that out of his own pocket. And so he said between Medicare and Blue Cross, they will not pay for it. He has to pay for that out of his own pocket. He has to take out a loan because he said he has no choice. The other thing that was prescribed to him as a medical necessity from the doctor is he needs a hospital bed at home because he cannot breathe at night. He's on oxygen, and if he stops breathing, that's it, he can die. So he needs the elevated bed, also too, so that he can get on and off it himself. That's something else that insurance companies denied completely. And so he said he priced it at $14,000. He's now shopping on eBay for a hospital bed. It's unbelievable. So I told him that I was coming here because I wanted to tell his story. Oh yes, and there was one other thing, and one day it was pouring rain outside. He was outside trying to get his wheelchair. He does still drive, but it's not easy for him to get in and out of the van. He was putting his wheelchair in the car in pouring rain. I ran over. I said, "What do you need me to do?" So he had me help him put his chair in the car so that he could get into the car, and he looked to be in so much pain. So I said, there has to be a better way. He said there is. They have vans for the disabled that's, again, has the lift on it. He said that was $75,000. And so for me, I keep saying, because my next mission in life is to write grants and to find monies for stories like that you all have, for stories that my friend has, and because people should not suffer. at all. And he's trying to do everything right, just as you all are, just trying to do everything right and play by the system. And the system is not set up for that. The system is set up to help the wealthy. And when I had asked him, I told him I was coming here to share his story. I said, to sum it up, what do you want me to get across? He said, in his experience, it's the health insurance companies that set what is medically necessary and what will be paid. It's not the doctors. So he said it needs to be the other way around, because the insurance companies are only looking out for their own profitability. They're not looking out for the people. So we need to change that around. So thank you all for listening, and God bless you all.